Okay, Curtis again, EMR class, chapter 5, communications and documentation. Let's go. So, introduction. Communications are important during every phase of the call. Hopefully that makes sense, because if without that, we don't know where to go. We don't know the details of the call. Lots and lots of things. So communication is going to be very important. We're going to jump off into that here in a little bit. So, the dispatcher, they must communicate location and the type of call to the designated responder, so we know where we're going, we know what we're going to, we might know to pay attention to this or look for that. Lots and lots of kind of specialized information that is possible. EMRs also need to communicate with patients and bystanders, family members, dispatchers, other members of the public safety community. So we need to be able to talk with each other, to understand. Maybe you work in a city or a district or whatever that uses 10 codes and the next surrounding city doesn't. Well, you need to be able to talk to your own people in the language that you speak. Now, some of you may not even know what 10 codes are, but it used to be like when you'd go back in service, it would be 10-8. What happened was, after some mass casualty events, like around here locally, it was after the Murrah bombing, they realized within the public safety community that everybody had different 10 codes. So someone's 10-8, which was back in service, might be arriving on scene, checking on scene. So all of that started changing to more of just kind of common speak, just more sentence structure communications. But once you've completed a call, it's important to document the condition of the patient and treatment given. We're still talking about communications. You need to be able to follow whatever it is your local protocols say for documentation. Now, the purpose of the communication system is going to be to send information from one location to another when it's impossible to communicate face-to-face. So when you have someone on scene that's 18 miles away, obviously you're not going to know what you're coming to if you're waiting to be face-to-face. So we're going to have a middleman, and that's going to be dispatch or whoever. But we have some way to get that information from one location to another. So results of using a communication system will be only as accurate as the information that you put into the system. You put the wrong address into the system, you're going to get a bad answer. You put the wrong patient into the system, you're going to get a bad answer. You put all this stuff in, all of it changes everything. So it's only going to be as good as the information that you put in. Now, you must have a basic idea of how your department's communication system works. You need to be basically an expert at what you guys and gals do. So wherever you work, whether it's just with a two-way radio or you use a complex dispatching system, however it is that you use and whatever it is you use, you need to be very good at it. And in the event it goes down, you need to know what your backup system is. And you need to be able to communicate. You can be out on a call and lose communications, and you need to know what plan B is. So communications can be divided into two categories, and those that transmit voice communications and then those that transmit data. So voice communications, they transmit a spoken word from one location to another. We talked about that. So you must understand the basics of a radio communication system and know how to properly operate the radio system used by your department. Once again, we go back to that, how you do things. Not everybody does things the same way, so you need to know how you're going to do things and what's accepted within your agency. So radio communications, they are regulated now, so pay attention to what you're saying, to whom and how you say it and all of that, because that communication is regulated by the FCC. So the Federal Communication Commission regulates radio communications. So frequencies or channels, they're assigned according to the function of the organization. So what you're doing and how you're doing it is kind of how the frequency is assigned. Now, you got different types of radio. So a base station, what we're talking about is that stationary two-way radio. It's located in a fixed place, and it's attached to one or more fixed antennas. And that's what you're using at basically your base station to be able to broadcast the information out. And then a mobile radio. So a device, it's mounted in a vehicle and draws electricity from the electrical system of the vehicle. And then the portable, the handheld, what you see in our picture there, and what you have probably on your person as you go out on calls, or maybe when you're on standby. A handheld self-contained unit that includes a two-way radio battery, a built-in mic, built-in antenna. It's just a little portable version of almost your base station. Then a repeater. So that's a device that receives that weak radio signal. It strengthens it, and then it automatically rebroadcasts it. So it helps us get that information further than what it's able to without it. And then telephone systems. So telephone systems primarily send voice communications. Landline phone systems, those are tied together through an above ground or even a below ground hardwired system. Mobile phones rely on radio waves between a mobile phone and a cellular tower to send and receive phone messages. Knowing that, hopefully that if you didn't already understand that, when you have a big natural disaster, tornado or something, that's why some of that can be taken down. That's why you won't be able to make phone communications, is because many times towers are taken down, as well as the system is just flooded with callers. And then smartphones uses advanced operating systems that combine the features of a cellular phone with those of a personal computer, and then obviously GPS as well, which make them really handy at global positioning system. So that's why smartphones are so handy, especially in the 911 world, because you can get directions where you're at. You can send somebody exact directions to where your location is. You have a lot of options. So data systems. Now, communication systems are increasingly used to send and receive data. All that data, it can be transmitted through radio, phones, or the internet. And then paging systems, they can transmit text messages or voice communications. So you do have an MDT like you see, and maybe you're lucky enough at your service you have something like an MDT. Transmit data messages through a radio system and are frequently incorporated into a mobile radio system. So that's what we're talking about with an MDT. So it sends you the information of where the call is. It might give you a screen with some information about the call. Just all depends upon where you are and what your budget is, honestly. And then fax machines. So they use phone lines, can use radio systems, but what they do is they send written data. Telemetry used by ALS, so ALS providers, we're talking about advanced life support providers. They transmit like ECGs, so your heart rhythms and that kind of stuff, and other patient data to online medical control. That's what we're going to be using telemetry for. And then digital messaging technology includes email and text messages, so social media, everybody's aware of that. Increasingly used by EMRs to send and receive information within public safety agencies. So, it's not a bad idea if somebody might want it, that you were to take a picture of the front end damage of a vehicle, so that people understand, where all the energy was transmitted to. Depends on where you're at, but you have a lot of uses for these type of devices. Now, functions of radio communications. So communications going to be used for a lot of different reasons. Calls for medical assistance, it can be broken into 6 phases. We're going to go through those. So dispatch, response to the scene, arrival at the scene, update responding to EMS units, transferring the care of the patient to other personnel, post-run activities. So that's what we're kind of talking about in those 6 phases. So we're dispatched, and then we get on dispatch and we tell them how we're going to be going and where we're going to be going. Okay, sorry if there was a little break there. Had someone come in. So I know we ended at dispatch. So we talked about how and where we were going to be going. So our response to the scene, that's going to be it. We're going to be responding to the scene. Hopefully, if there's more details or more information to be passed on, we're going to be getting that on our way to the scene. Once we get on scene, we are going to be allowed. We're going to let dispatch know that we're on scene, and we're going to set up command, whatever that looks like at your own place. Then once we find out what's going on with on scene, we're going to update the responding EMS units and start giving care, start delivering care, and then transfer that care once they get there. And then we're going to go back, slap high fives, write out our reports, and hopefully have a good night after that. So let's talk about some of that. So dispatch can use voice, text messaging, MDT, all that stuff that we already mentioned, to alert responders to an emergency. So it is your responsibility to keep your equipment ready to receive a call whenever you're on duty. I can tell you this, most people don't care that your radio ran out of batteries and you didn't realize it. I mean, they are going to care. They don't care that it wasn't your fault, because it is your fault. You're responsible for your own gear. So if you're not sure that all information's been received correctly, once you get that, ask the dispatcher to repeat it. Make sure that you get all the information that you need. Now, we said respond to the scene. So if you don't already know how to, you need, if you don't know your response area already, you need to get to know your response area. If you're in an ambulance, one of the things I always suggest, or even in a rescue rig or whatever, go drive around if you don't know it. Let somebody that's been around a little bit show you some kind of your frequent areas. Show you where the hospital is and where the schools are and that kind of stuff. Learn your response area. Learn how to use your maps. Now, maps are different now than whenever I first went through this training, because maps used to be on paper. Now everything's on your screen. So you have GPS positioning and all kinds of stuff, but learn how to use that stuff. I can tell you in some small areas, Google can be different than your Apple iPhone map, and find out what those are. Find out any weird little anomalies that might happen within your district. So the dispatcher may give you further information about the location of the call or the condition of the patient while you're en route. They may say, well, the patient stopped breathing, or there's a subsequent car crash in the middle of the highway, and they may give you some just ongoing details. Now, if you're unexpectedly delayed or encounter any problems en route, let dispatch know. Make sure they know that you've been delayed by a train. Don't go in front of the train. I've seen that happen. That could end really bad, but let them know that that's what's going on. One thing I also suggest, even though as an EMR you're not as responsible as a paramedic, but make sure you put that in your documentation that you were delayed by whatever, fill in the blank with whatever it is. That way maybe your city manager or your fire chief or whoever's looking at that kind of stuff will understand you were en route, you were delayed, and it wasn't your fault. So arrival at scene. First thing you're going to do, perform a visual survey of the scene as you arrive. You want to take a good look around before you even get out of your truck. Look for danger, look for security issues, look for everything. So give the communication center a brief verbal description of the scene. So your report should verify a few different kinds of things that you see listed. Location of the incident, type of incident, any hazards present, number of patients, and then any additional assistance required. So you'll want to be able to give them that information. Your particular response agency may want something different, so just be prepared, but this is a pretty good little format here in the event you don't have one. Now, update the responding EMS units. You'll be expected to update those units about the condition of your patient. So what are we talking about? We're talking about the age and sex of the patient. So 38-year-old male, you see chief complaint. So unrestrained driver in a head-on car crash. Level of responsiveness. We'll talk about this later, but are they alert? Are they verbal? Are they unresponsive? Are they, what's their responsiveness status? Want to tell them level of responsiveness and then the status of A, B's, and C's. And we're going to get into what all of that means pretty soon. And then transfer a patient care to the other EMS personnel. So you want to make sure that you're helping give that information to them and help them load off, and whatever you need to do, help them get that patient loaded into a helicopter, into the back of an ambulance, wherever it goes, you help them with that. Now, easiest way to report your patient assessment results is to use the same systematic approach that you follow during patient assessment. As you go through this training and as you go through training, the skills portion of this, I always recommend that, and a big word that I just said was systematic. You look at this with a systematic approach every single time. That way, when you get in the middle of something that kind of overwhelms your senses because of adrenalines or smells or sights or whatever, you've got that muscle memory that you do the same systematic approach every single time. You're not distracted by things that elbows that are going in the wrong direction, or their heads laid open, or whatever, all of that stuff. So build that approach the right way, do it the same way over and over and over and over. So some of that we're talking about, you want to provide the age and sex of the patient. We're talking about that patient assessment that we see on the screen. Describe the history of the incident, describe the patient's chief complaint, the patient's level of responsiveness, and then how you found them. That may seem like a weird thing, but typically, from a very basic standpoint, if you find someone positioned in a very awkward and uncomfortable position, and they're not being held there, that can let us know about kind of some neurological injuries, because typically we don't want to sit in a really awkward, uncomfortable position. So body positioning can be a deal. So make sure that you're aware of all these. Now, report the status of those vital signs. So we're talking about blood pressure and pulse and respiratory rate. And then we're going to look at our A, B's, and C's: airway, breathing, circulation. Describe the results of the physical exam. So any extra holes, any extra elbows or knees, any extra things, that's what we're looking for. Report any pertinent medical condition using the sample format. We'll talk about that as we go along. And then use the same systematic approach that you follow during your patient assessment to help ensure you do not overlook any significant symptoms, signs, or injuries. So you'll notice we keep kind of saying the same thing. Make sure you use this systematic approach to do your patient assessment, to report your patient assessment, and every single time. And we'll make less mistakes. If you think you're going to be able to go out and do this job without making some mistakes, you more than likely are sadly mistaken, because many people that have very, very many years in this job, we all still make mistakes. That's what's going to happen. What we try to do is limit them. So, with the whole going back to that first do no harm, we want to limit our mistakes, and we want to limit the amount of mistakes that put people at risk. So we do these things over and over the same way so we won't miss things and blah, blah, blah. Now, transferring care. Online medical control, generally used by the EMTs and paramedics to secure permission to perform certain skills. Still talking about radio communications. Get direction regarding patient care. Give patient care reports to the hospital. So if your EMS system uses online medical control for EMRs, you're going to need to learn how and when to contact medical control. This may or may not affect you, because maybe you go on to EMT class and you learn a whole new set of skills, and you may need your doctor's permission to do certain things and all of that. So some of that stuff may or may not affect you. Post-run activities. So we mentioned that at the end. We're going to get to our post-run activities. After you've turned over the care of your patient to the other EMS providers, you need to report your status to Communication Center. So you're back in service, headed back to the station, or you're going to go refuel, or maybe you got to go clean up, or whatever. Let the Communication Center know how long it'll take you to get your unit ready for service and when you'll be available for another call. Whether you work in a busy service or not, you can get back-to-back calls. You may work in a service that runs 300 calls a year. But you've got to understand there's going to be some days you won't turn a wheel, right? You're not going to make a ride. Well, by statistically speaking, you got to make those numbers up somewhere. So one day you're going to run 2 or 3, and some of them may be back-to-back. One call can affect the next one. So you've got to understand that sometimes you may go from one call to the next call, or say you go to a busy place, you may just run from one call to the next. So you just got to let them know what you're doing, how long it's going to take you to get back in service, and go handle your business. So, and then providing a written report of a call is covered under this section on documentation. So here's guidelines for effective radio communication. I'm going to let you guys read those at your leisure. I'm not going to read them to you. So effective communication, what that means that the person receiving the message understands exactly what the person who sent the message meant. So it's very clear, it's very concise, they understand what I'm saying. So effective communication requires feedback. The receiver needs to communicate to the sender that the message has been received and understood. So you'll go back to them on the radio, depending upon how you speak at your station, but that message is received, or 10-4, loud and clear, copy, blah, 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 whatever. Both external and internal distractions can negatively affect communication. When you're on the bad scene, it's very easily to get your communications distracted because of loud noises, things that you're seeing with your eyes, emotions that you're feeling, all of that. So internal and external can certainly affect that. So noise, other use of electronic devices, all of that can certainly constitute external distractions. And then internal, so such as letting yourself think about a personal matter while on a scene. We want to leave all that stuff back at the station. You can't be doing that. You can't bring that junk with you, whatever it is, because it can affect you in a negative way. Now, communication can also be affected when an EMR lacks empathy. Maybe you have some prejudice kind of things about certain people or a certain neighborhood or a certain whatever, and obviously communications can be affected in that. And in this day and age, we've got no room for that. So we want to make sure that we're taking care of people correctly and the right way. So verbal communications with the patient, the family, the rest of the healthcare team, going to be an essential part of high quality patient care. So you must be able to determine what the patient needs and then explain this information to others. I believe I've used this phrase already, but you are to be a patient advocate. You are to advocate for your patients. So doing what's best for them, being able to communicate effectively for them, all of that kind of stuff. That's one of our main goals as a medical provider, is being a patient advocate. So, guidelines for effective communications with patients. I ask that you always introduce yourself by your name and your title. Now, something you need to think about. So your gestures, your body movements, kind of your attitude toward the patient. If you have your arms folded or you're kind of grumpy and you got like a furrowed brow, all of that stuff, that can definitely get in the way of gaining trust of your patient. By introducing yourself by your name and who you are and who you're with, that we're starting to hopefully be able to build some trust. We're hoping to calm our patients. You got to realize many of these patients, whether it's a real emergency or not, doesn't matter. This is a real emergency to many of our patients. So what we have to realize is this could potentially be the worst day of this person's life, and they're going to be a little wound up and they're going to be a little anxious. So first thing we want to do is try to calm them down and reassure them that we're there to help. We're not making things worse off. We're trying to help. So we want to introduce ourselves. We want to ask the patient's name, and you want to use it. Make and keep eye contact. So use the language that patients can understand. We're going to learn some fancy words here in a little while, and sometimes people want to use those kind of to baffle people, that make you seem like you're a medical professional. Doesn't matter. Nobody cares that you know all the big fancy words if nobody can understand how to use them. If you're not using them properly or they don't understand what you mean, nobody's all that impressed. So don't worry about it. And when you're an expert at anything, if you're a welder or you work at some other type of industry or whatever, you can baffle somebody with all kinds of fancy words. Nobody cares about that. It doesn't mean anything. We're just trying to communicate with people and use that language that people can understand. Also, slowly and clearly. So you see that gentleman there, he's talking to an elderly lady. What happens is people tend to raise their voice and go a little bit slower and all of that. And many times the older community gets really irritated at that because they don't need you to slow down and they sure don't need you to yell at them. So, we want to be thoughtful about that. I'm not even saying that we do that intentionally, just sometimes what happens. Now, another thing, tell the truth. You don't have to, I've said this before, you do not, and I ask you to not say everything's going to be okay. It's not. When you're doing CPR on a little baby, everything's not going to be okay. What you can tell people is you're doing the best that you guys can. You're doing the best thing for the patients that you can do, whatever. But tell the truth. Don't make up stories to make people feel better, because all that does is mess it up for the entire scene. So the next level, the next providers, the ER, everybody, the parents, obviously, everybody, just tell the truth. And then allow the time for patients to respond. Make sure you limit the number of people talking with the patient, and be aware of your body language. So if you're having a bad day, maybe let somebody else talk. Don't be thoughtful about the way that you're standing. If you look kind of intimidating, do your best to not look so intimidating. So if you have kind of that resting, angry face, then do something about it. Fix it. Maybe you just need to smile a little bit or whatever, but try, be aware of your body language. And then act and speak in a calm and confident manner. Somebody's going to be looking to you to be the calm person in this mess, in this big old mess of a scene. And you need to be the calm person within this storm here. Respect cultural norms. In Oklahoma, we have lots and lots of communities. So, if you're able to, if you live in a district where you have certain things that are going on, be thoughtful of it. Maybe there's something you need to learn about somebody. That's fine. Learn about them and respect that. Don't just do it. Well, this is where we live and this is what we do. And, be thoughtful about that kind of stuff. Respect cultural norms if you can. If it's not inappropriate or if it doesn't go against your protocols and all of that, and your integrity and ethics, then there's nothing wrong with respecting people's cultural norms. Use open-ended and closed-ended questions appropriately. What that means, open-ended versus closed-ended. So when you ask somebody, does your chest hurt? That's closed-ended, just yes or no. That doesn't help us determine kind of, like where things hurt and all that. And just say, where do you hurt? And they'll say, oh, and they'll point right here. Oh, in your chest. Okay, can you describe what it feels? Versus, is it sharp? Is it dull? Does the pain move? All of that. Say, tell me about the pain. Point to it exactly where it hurts. Can you describe it for me? That type of stuff. So you want to use open-ended questions when it's time to. Sometimes you do need to know when to use closed-ended questions. Because sometimes people will just go on and on and on. And you're just trying to find out if they took their medicine today. And then treat all patients as if they were members of your family. And that's where that whole being a patient advocate comes in. We want to make sure that we're treating people appropriately. Now, special needs patients, communicating with patients with special needs. So patients who are hard of hearing or deaf. So a patient of age may be unable to hear for a variety of reasons, maybe hereditary deafness or long-term deafness caused by illness, temporary deafness. Maybe you're on a bad scene and there was an explosion or something or a loud noise that messed things up. So ask or write out the question, can you hear me? If you're dealing with someone that doesn't seem to be able to hear you. So after you determine the patient is hearing impaired or deaf, don't continue to rely on verbal communication. So when working with patients who are hard of hearing or deaf, use some different techniques. So, let them know that you're there to help. Show them your badge or show them your patch. Touch the patient. So a patient is hard of hearing or deaf, they're going to need some human contact just as much as a hearing patient. So you're going to need to be able to just touch them to get their attention. Face the patient when you speak to them. Speak slowly and distinctly. Do not shout out. And then watch the patient's face for expressions. Now, repeat or rephrase your comments in clear, simple language. Many people are really good lip readers, so make sure you clear and simple language. All this fails, write down your questions on a piece of paper and ask them to respond. So some people are both deaf and blind, and so take your time, be patient, use touch as a way of communicating. And then, like all other patients in similar circumstances, deaf parents must give their consent for you to treat their child. You can't just go taking people's babies and start doing stuff to them. Now, communicating with patients who are visually impaired. So look for signs that suggest the patient may be visually impaired. So let them know what's happening, identifying noises, describe the situation and surroundings, all that stuff. Learn their name and use it throughout your examination treatment, just as you would with every other patient. Now, if they have a service dog, you try to keep the patient and the dog together. Non-English speaking patients. So you may be able to adapt some of the techniques recommended for communicating with a patient who is hard of hearing or deaf. So supplement your questions with hand gestures, finger pointing, facial expressions, and then determine how much English the patient speaks, if any, and find out if a family member or a friend can function maybe as an interpreter or something for you. Some places have some language assistants that you might be able to get connected with as well. Now, geriatric patients. So when you're dealing with older people who suffer from hearing or visual impairment, you want to use the same communication skills you would with any other patients with similar conditions. So, the thing is, as I was mentioning, you don't want to assume that all older patients have physical or mental impairments. It's not fair and it's not a good way to take care of people. So assess all patients carefully, give them time to respond to your questions. Sometimes things, the motors work a little bit slower, so they just need a little bit longer to get through that. Now, pediatric patients, so caring for ill or injured children, that's going to be very stress-producing for most EMS providers or EMRs, because you're dealing with parents and you have the innocent child and all of these things, and we're thinking about our own kids and all of that. So it is going to be stress-producing. So children and their parents or caregivers are often frightened and anxious, so familiar objects and faces can help calm a child. Talk to both parents and child as much as possible and tell them what is happening. Ask a parent to hold the child if the illness or injury permits. And then let them know your name and explain to them what you're doing if that's appropriate, if that helps with something of an older age kid. So squat, kneel, or sit down. Don't stand, over them, hovering over somebody. It doesn't build trust that way. Be honest. One of the things that I hate the most is when somebody will say, no, this is not going to hurt, and they want to start an IV on a little kid or something. And now they don't trust you. So hopefully you got that IV, because you're probably not going to get another shot at it. So you need to be honest. Just tell them it's going to sting just a second, and then hopefully we'll be done, and all of those things. Also get mom and dad to be able to help. Maybe grandma or grandpa that's there, but get them to help if possible. Now, developmental disabilities. So ask the family or the caregiver about the patient's level of communication, because maybe they can't communicate with you. Who knows? Speak slowly, using short sentences and simple words. You may need to repeat or rephrase statements several times until the patient understands what you want. And then you may be able to adapt many of the techniques that you use when treating children to work with the developmentally disabled patients. So being able to communicate is going to be a good thing. Now, disruptive behavior. So disruptive behavior can present a danger to you, the patient, other people at the scene. It also can definitely cause delays in the treatment. So managing patient who's exhibiting disruptive behavior. So you want to take some of these steps. Kind of see some stuff listed there. So assess the situation. You want to kind of figure some things out. Protect the patient and yourself. Stay between the patient and an exit whenever possible. Do not take your eyes off the patient or turn your back. And then if they have a weapon, stay clear. Wait for law enforcement personnel. No need to get hurt while you're there trying to help somebody. And then as soon as your personal safety is assured, then you can provide the appropriate emergency medical care. Now, sometimes family members or friends of the disruptive patient may insist that you take the person to the hospital, but remember, you cannot take a competent individual against his or her wishes. It doesn't matter that wife wants you to. It doesn't matter that dad wants you to. It doesn't matter if son wants you to. If they are competent, they can answer the appropriate questions. None of that matters. Now, you may need to get law enforcement involved, but make sure that you are doing what is right. Medical terminology. We kind of mentioned that about all of the big fancy words that we're going to be talking about. But medical terminology, what we're talking is a collection of technical terms used by medical personnel to do a couple of different things. As you see listed, identify anatomic parts of the body, specify illnesses and injuries, and then indicate treatments given. So medical terminology mostly just intended to clarify language so one person communicate clearly to another the anatomic location of an injury, signs, symptoms of a disease, and the treatments given. So, whenever you say certain things, people that know that language, and it really is its own language, they know exactly what you're talking about. So your job as an EMR is going to be able to communicate your message to other medical providers as clearly as possible. Don't use medical terms if you're unsure of their meaning. I've seen that many times, and I've probably done it myself many times when I was brand new, using a word inappropriately just because it was a cool word and you thought you knew what it meant. So don't do that. New terminology is introduced, so look at the parts of each word as you start seeing these things, as we start talking about them, and as you start reading about them. Look at the parts of each word, and then learn commonly occurring prefixes and suffixes. So that's going to help you kind of gain some insight into this new language that we're talking about. So prefixes commonly used in medical terminology. So we see here, we have Brady, which means slow. So we're talking about a breathing rate or the heart rate. Tachy, another word, Brady and tachy. Tachy is going to be fast, rapid, or swift. Therm, in relation to quantities of heat. So maybe a thermometer. So hyper, above the excessive or beyond. So it's high. Hypo is going to be low, below, underneath, or deficient. So naso, denoting the nose. Oro, denoting the mouth. Arterio, relationship to an artery. Cardio is going to be heart. And you see hema, or hemo is all blood. Neuro, denoting nerve, nervous system, or nervous tissue. And then vaso, vessel, as in blood vessels. Some of those are ones we're going to be using in this class, and just a handful of things that we're going to be talking about. So like some of this, now this is the prefix, and then you're going to attach it onto something else. So Brady, slow, and then cardio, we're going to be talking about a slow heart rate. So it'd be bradycardic or tachycardic. Or when we start talking about respiratory, you'll see like PNIC, and I don't remember exactly. That has to do with respirations. But so you're talking about bradytnic or tachypnea. So tachypnea is going to be fast, or tachypnic is going to be fast respirations. So lots and lots of words. Now, you'll find them, or not all, but you'll find a bunch of them listed in your textbook. Just start kind of becoming familiar and make sure that you're familiar with the ones your service uses anyways. Now, documentation. Second major type of communication that you will use in your daily work as an EMR. So documentation, it's a process for verifying your actions using written or maybe computer-based, electronic records. Now, by recording your actions, you provide a record for others and a document that you can refer to in the future if necessary. And hopefully what you hear by that is that you can refer to if necessary in the future is in the event you ever get called into court. That's why it's really important that you do a good job at documentation. Documentation provides a legal record of the actions that you took. If you didn't document it, you didn't do it. That's pretty much the policy. So make sure that you are documenting things. It also offers a basis to evaluate the quality of care given. So in the event your chief looks at something or your director looks at something or whoever, then it's going to help determine kind of the quality of care that you gave. So want to make sure that you're doing a good job and documenting a good job. So proper documentation includes the following: age and sex of the patient, history of the incident, condition when found, and then the description of the injury or illness. Their chief complaint, their level of responsiveness, or maybe you might see LOC, level of consciousness, their status of initial and subsequent vital signs, so their initial vital signs and then maybe 5 minutes later or 15 minutes later or whatever. Their A, B's, and C's, so their airway is open, they're breathing normal, they have a good heart rate at 92 or whatever. Results of the physical exam, so you're kind of wanting to find what's wrong. When we look at that physical exam, their arm's broken, or you suspect it's broken, or their left lung's not working quite right. Yeah, you don't see any movement and you don't hear any breath sounds. Those are the things that you're wanting to really make sure that you point out. Pertinent medical conditions using the sample format, and then treatment that you gave the patient. So what did you do? What you found, and then what did you do about it? Now, what did it do? So any change in patient's condition after the treatment. Agency and personnel who took over treatment of the patient. So, handed off patient to Rob from IMSA, at 1534. Following times: time you were dispatched, time you arrived on scene, time other providers arrived on scene, time you departed scene. So all of this stuff is important stuff to remember. And then complete your patient care report as soon as possible after each call. For one, it's just good policy. Two, it helps you to remember some of those smaller details. So you want to be clear, concise, accurate. If you do make a mistake, draw a line through it, initial the error and correct it, of course, comma, unless your agency has you do a different way. But I suggest that you do it this way, because this will stand up in court and it allows them to know that you made a kind of an addendum, that you made a correction rather. So your organization may rely on patient care report, so a PCR, for documenting reportable events. Some of those things are like knife wounds, gunshot wounds, motor vehicle collisions, child abuse, domestic violence, a lot of different things. You may or may not need to report these things. So it's important that you learn how the reporting process is handled in your agency and what you're required to do. Maybe that means that you call the ER and you call a caseworker, those type of things, those violent injuries where someone was attacked, or there's a suspected abuse. Those are kind of things that are reported. So, summary, just quick little bullet points here. Communication systems, one location to another. Going to be very important that we have excellent communication skills. basic idea of how all of this stuff works. When I push this button and I talk into this little box, then my people down on the other side of town, they hear the noise come out of the other little box. It might be a little more tricky than that, but whatever. So you must be familiar with a two-way radio communications, having working knowledge of all that. You need to understand that. I'm not asking you to know how to reprogram it. I'm not asking you to know how to fix it, but you need to know how to use it. Don't get caught, and for no other reason, be selfish with this stuff, guys and gals. Do not get caught in a bad place and you don't know what to do. If you are unsure of how to change the channel on your radio and that gets bumped on a call or whatever, you're unsure of how to call for law enforcement, for backup, for another ambulance, for whatever, you're kind of, they call SOL, I think is one of the things they call that. You're not going to be having fun. It's going to be a bad day for you. So don't do that. Think about yourself. Be selfish with some of this stuff if you have to. So it's important you learn and follow your standard procedures and protocols for communications, whatever that means. Make sure you learn your language when we start talking about, that you're going to be talking on the radio and you're giving patient reports. Make sure you know this language. It's a whole new language for people that haven't been around this. You have a language that you're using on your rig, whether you're on a fire rig or maybe an oil rig or wherever. You've got its own language. I don't mean like dirty words. I'm talking about this is what we call this en route and standby and all these things. And then the medical language is a whole nother language. So you gotta pay attention. And then, body language, attitude, all of that stuff. We're talking about kind of hard ways to communicate with people. We mentioned that. And then radio or report, complete a formal written handoff report. Just take your time, have fun with it, write out a little story. It gets to, it can be kind of a drag at times, but you're probably not going to be having to write out many of them. So do a good job. The one thing that I try to get people to do is to think about when they're writing that report, they write it like they're going to have to go to court. And if you do that every single time, you're going to write out a really good report. There may be more information that's what's needed. That's okay. In the event they go to court, it's going to keep you off the stand because you wrote out a really good report. You'll just be some kind of witness rather than the defendant because you did some boneheaded move and screwed it up. And then, as we just talked about documentation, remember the call is not over until the paperwork is complete. So the call is not over till the paperwork is complete. And that is it, guys. That is chapter 5. And we'll catch up with you on the next one.